Hello, everyone. You're tuned into Open Studio. This is Cape Town, Channel 263. I'm your host, Thabang Segaecho. Today, I've got an exciting guest, Mr. Kevin Alexandra. He's actually from the Sea Point, Fresnay, and Bentry Bay Residents and Ratepayers Association, right? Based here, right here in Cape Town, doing exciting stuff, so I've come to learn. Hey, Mr. Kevin. Wonderful.
Thank you.
I'd like to take this opportunity just to welcome you to the show.
Thank you, Thabang, and thank you to your viewers for having me.
Wonderful, thank
Thank
you.
you.
I'm glad that you could make the time to be here today. Just quickly, Mr. Kevin, would you just tell our viewers a little bit about yourself and in the role that you actually play within the organization itself?
Okay, so I'm the fieldwork coordinator for an organization called Project Hope. So Project Hope is an organization that was established by SFB, which is the Ratepayers of Sea Point, Fresnay and Bantry Bay, Ratepayers and Residents Association, to specifically deal with homelessness in that area. So it was SFB and another NGO called Play Sport for Life. So the two organizations got together and decided to start this organization called Project Hope. Now, I have quite extensive experience going back a couple of years in working with homeless people in different capacities as manager of the Haven Night Shelter in Greenpoint, supervisor at another night shelter, and also working with an organization that deals with substance abuse. So over the years, I've had quite a bit of interaction with homeless people. So with Project Hope, we specifically want to address the homelessness in Sea Point, Fresnay and Bantry Bay, but also beyond. So our focus area at the moment is the SFB area. Okay? And I'm the fieldwork coordinator. We have one or two extra field workers who work with me. And then my role is to interact with the homeless people one-on-one, to profile them and then offer services to them as well. And then also supervise the field workers and any projects that a Project Hope come up with.
Wonderful. So you're pretty much on the field.
Very much in the field, yes.
Right, that's wonderful.
Absolutely.
Hands-on.
Hands-on.
Yeah, I like that approach that works every time.
Yes.
Wonderful stuff. So for you, when did this journey actually begin? When did you become officially or be part of the founding
Yes, we found
members?
that smack in the middle of COVID-19, last year 2020,
Oh, wow,
around
last
about
year.
June 2020, where there were obviously more people becoming homeless and ending up on the streets. That's when Project Hope started, and I started with Project Hope about a month later on the 1st of July last year. And I can tell you this much, I never looked back. It's been a wonderful journey for the past couple of months. And I think we're making waves, we're making a difference.
Wonderful. And speaking of that, the change that you're saying that you're definitely making in and around the area,
Yes.
how has the other residents received your efforts?
Very positive reaction from residents. Because what we try to do with Project Hope is to create a win-win situation for both residents and for homeless people. So it has to be mutually beneficial to both,
Right.
to the residents as well as to the homeless persons. So where the residents, we don't want residents having homeless people scratching in their bins and sleeping in their driveways. And for the homeless people, we don't want homeless people having to sleep in driveways and having to scratch in bins.
That's
where
right.
we up their dignity and try and address the issue that way.
I love the fact that you mentioned the humanity and the dignity, of
Absolutely.
just being a human.
Absolutely, yes.
Would you like to touch on that a little bit for me? Because I want to know for somebody on the receiving end, which is somebody who's like, one of your homeless people,
Yes.
how do they react to the help that's coming from your organization?
On a day-to-day basis, when I go out on the street, obviously with homeless people, with some homeless people, there's the apprehension. So one has to build trust over a period of time. So what I do is, and what the field workers do, is to have several contact sessions with people on the street.
Okay.
Until there's a trust relationship, And then we offer them services. We offer them services either of reunification to reunite them back with their families, or reintegration to reintegrate them back into society. Because remember, a lot of these people have been living on the streets in the area for
For a very long time, yes, yeah.
a long time. So they're part of the community. But we need to take the vagrancy factor away and make them meaningful or productive members
of society,
of the community again. And then also to refer them to shelters and to safe spaces. Not just to get them off the streets and to turn their lives around.
I love that. That is the win-win right there.
That is
So
the
you are
win-win I'm
saying
talking about,
There is
yes.
hope, right? Hence the word, I guess, Project Hope. And
That's correct,
is that
yes.
how it came about? Wonderful. So it's to say somebody on the streets, they can actually be an active member,
An
right?
active member of society.
One that contributes positively, right?
That's
to
correct,
to the
yes.
society. That's great.
Yes.
And for you, what are the challenges, would you say? Because I really want to go there, focus a little bit on your interaction with the street people. What are their challenges? What is for them when you engage with them? What are their common challenges? Because with crime, and I'm sure they get victimized a lot. It's not always
They do,
right.
they do.
Right? Yeah.
Now, the challenges that they experience on the streets there are various challenges for them,
Yes.
for people on the streets. Obviously, the criminal factor. And dealing with homelessness, one needs to separate the homelessness from criminality, because criminality is dealt with by SAPS, by the police, and with law enforcement. But then there's the social issue. That's where we intervene, where we come in. As there are people who are truly homeless.
That's right. Yes.
There are people who are genuinely homeless. Then there are people who want to be homeless. Your criminals, your opportunists.
Opportunists who ride on the wave.
Who ride on the wave.
Yes.
For us as an organization, Project Hope, by the way, HOPE is an acronym for Homelessness, Outreach, Prevention, and Education. Homelessness, Outreach, Prevention, and Education.
That's very comprehensive.
Yes, very comprehensive. Covers everything, basically.
Absolutely,
Okay.
yeah.
But challenges that we face on a daily basis, for example, are things like shelter space, bed space at shelters.
Okay.
We have approximately 11,000 people in the Cape Metropole who are homeless.
11,000. You know what, Mr. Kevin, we just quickly need to go to a break, so I would like you to hold that thought for me.
Okay.
When we come back, we will just continue the conversation. Thanks for
Thank you.
watching. Welcome back. This is Open Studio. You're watching Cape Town TV, channel 263. Thank you so much. I'm so glad that you could tune in. And today, as I was saying earlier on, we are here having Mr. Kevin from an amazing organization called SFP, right?
Project Hope.
Yes, SFB, sorry, project, right? Which is based in Venture Bay, Sea Point, Fresnay, right?
correct, yes.
So it's a project that you go out there and you're trying to integrate the homeless people back into society
right,
by exploring different mechanisms to
Yeah,
that.
yeah,
Before the break, Mr. Kevin, you were just mentioning, just giving us like a quick dynamic or geographical overview of exactly where the situation stands in the country or in the places that you attend into with regards to homelessness, like how it's so prevalent within our communities. Won't you just pick up from where we left off on that?
Yes, in the Cape Metropole, for example, we have approximately 11,000 people living on the streets, homeless people, for the various reasons. And one of the big challenges we have is placing those people in in shelters and in safe spaces. Now, there's a maximum of 4,000 bed spaces available to place homeless people at. So what do you do with the 7,000 people? that we
Exactly,
can't
yes.
place?
Right.
So most of the shelters are run by, like, for example, they have a night shelter. All these shelters are most of them are funded by Western Cape government, by provincial government. But then the city of Cape Town, local government, also started developing the safe spaces. So there's 2 safe spaces at Kulenburg, under the Nelson Mandela Bridge in town. One is called Safe Space 1, and the other one is called Safe Space 2, or Safe Space 2 is also known as parking lot, safe space parking lot. The one can accommodate approximately 280 people, but now we're still under lockdown,
Right.
even though it's level 1, they take in now a maximum of about 180 people. And at Safe Space 2, they have a capacity of about 95 people. Then there's also one out in Belleville called Paint City. But in total, all these shelters together offer a maximum of 4,000 bed spaces. So you can see what the
Yeah,
challenges that we
the
have.
gap is
You
way
see.
too is way
Then,
too
of
large.
course, we have
Yes.
challenges like we need specialized shelters. We need shelters for mothers with children, or for families with children.
Yes.
Because most of the shelters only take homeless people in who are over the age of 18.
Right.
For, the Haven Night Shelter have 2 criteria for taking in homeless people. And those criteria are, number 1, you have to be homeless, and number 2, you have to be over the age of 18.
Right.
There's a whole lot of people, homeless people on the street, who have children under the age of 18. So that's a different.
That's correct. Yes.
That's
No, it's nobody catering for that
Yes,
gap right
yes,
there.
yes.
Yeah.
Then there are your mental patients. People who have mental challenges, who are intellectually challenged, who are out on the street. There's not many shelters available for them.
Exactly. Yeah.
And the shelters, most of the shelters, they only take a maximum of 5% of their capacity um, uh, to deal with mentally challenged people. I think if the figure is over 5%, they also have to register, besides the Department of Social Development, they also have to register with the Department of Health
Right.
for them to employ psychiatric nurses
Yes.
or
Yes. To cater for
extra
them.
specialized staff and that.
That's right.
Then there's the LGBTQI community as well.
Right.
There's currently only one shelter I believe it's in the whole of Africa, which is Pride Shelter up in Gardens. They're the only shelter specializing in taking in gay people or LGBTQI community members. Then there's victims of gender-based violence, people,
Yes.
women on the street.
Yes. Yes.
Okay, we all know of Sarki Bartman Center.
Yes.
They normally fall to capacity.
Yeah, that's right.
So these are the specialized shelters that's hugely lacking,
Yes.
and
Yes.
that we need more shelters to place those people. So it's quite a headache when you come across a family or a woman with children, the woman is a victim of abuse, to place a woman like that and to get a social worker involved who's going to separate her from her children, get her
Yes.
into a safe space, and the children go to a safe house somewhere else.
Yes, yes. Hence your approach to try and incorporate the comprehensive, aspect into the whole.
That's right. That's correct.
To the
Yes,
whole
yes, yes.
organization. And what would you say mechanisms that you have explored as an organization, right? Unique ones, that you think that, what, for so long this has been addressed in a certain kind of way. So
Yes,
maybe
yes,
let's
yes.
just try something new to see how, if maybe you can get different results.
and then-
How have you actually
Yes, yes,
explored
you
that?
see, now you make me excited. You make me excited.
I'm glad.
Yes. So Project Hope came up with the help of SFB, of course, to have this paradigm shift where we need to do things differently. And this is a model we've been brainstorming and explored. And it's a meaningful way to reintegrate the homeless people back into society.
Right.
So what we've done, we started out with a pilot project. On the Atlantic seaboard, from Three Anchor Bay all the way down to Saunders Rock, there are 8 different beaches
Right.
in the Sea Point and Fresnay and Bantry Bay area on the seaboard. So we chose one beach. Rocklands Beach is one of the smaller beaches. And made an opportunity available for 2 homeless people, 2 homeless males. The one used to volunteer for a couple of months just to pick up papers and keep the beach clean and stuff like that. So we thought,
That's right.
let's get this person, speak to him, find out how he does it. And we said to him, he was living on the street, he actually slept on the beach.
Yes.
And we said, if we place you in a shelter, will you take up that offer? And they said, yeah, that is what he's been looking forward to all this time.
Yeah.
And we said, okay, you keep the beach clean, the whole beach area. So it
Yes.
would be the beach, the section of the beach,
Yes.
the promenade in front of the beach,
Right.
the lawns,
Yes.
and also the
The pavement.
section of beach road
Yeah.
where, to take care of the car guarding, for example.
So he has a section
He has
allocated for
a
him.
section allocated to him.
Right.
And not long after that, he had another homeless guy who was interested.
Amazing.
Amazing,
I
isn't
see.
it?
I see exactly where. Yeah. Yeah. I see where you're
You see
going.
where this
Yes,
is heading.
it's brilliant.
So we placed them in shelters, and with help of SFB, the Ratepayers Association, where residents decided to fund the shelter fees for them to stay at the shelters.
Ah, that's brilliant. So
Yes.
they essentially working, right,
Yes.
for that, right, for the accommodation, but they are being also useful and addressing to that which
Yes.
speaks
So
to,
they
you
do
know.
the beach conservation,
Yes.
and also to educate beachgoers about littering and about
That
all kinds
is
of, and keeping the
the beachfront clean.
antisocial behavior of the beach.
Amazing stuff. That is so brilliant. When we
Yes.
come back, I would like to go further on that. Thank you so much for watching. You're watching Open Studio. This is Cape Town TV 263. We'll be right back.
Thank you.
If you've just tuned in, you are watching Open Studio. I'm Thabang Segaecho, and this is Cape Town TV channel 263. Welcome back. Earlier on, Mr. Kevin, we were speaking about your organization, right? SFB, which is based in Bantry Bay, Fresno, Sea Point, right? And you're doing this amazing, you know, Project Hope. We just spoke about it earlier, and this amazing, unique concept that you have, you know, about the guys coming in, you know, the homeless people doing something to earn their way to decent accommodation. But like you're saying, that explains exactly how the residents play an active role in supporting your organization and how then it benefits
Yes.
the street person and how vice versa. You know, the front, you like you were saying so beautifully, how the beachfront gets taken care of, it gets to be clean. And you mentioned something interesting that I wanted to know actually, that they educate, right, residents or even tourists, I would say, right, about the environmental aspects of maintaining a clean beachfront. And where they're getting this information, are you guys training them on that?
We touch base with them every single morning. So,
Right.
and when we see there's been, like, I'm not normally there over weekends, but they are there.
Yes.
So normally before the weekend, we would touch base with them and say, tomorrow the weather's going to be, and there's going to be a flood of people coming to the beach and that. And then they will share their experiences with us of what with people dumping cigarette butts on the beach, and they had to tell people. So I said,
Not to do it.
fantastic.
I love that because there's the educational
That's
aspect
education
which speaks
coming
to
from
your
them,
project.
by the way.
Yes, which is
Yeah.
quite interesting,
That's
right?
quite interesting. So we just
Amazing.
sort of enhance that and
Yes, you
give them
support
more
that.
information. Okay, also tell people not to dump their styrofoam packets and their plastic and stuff to prevent it from going into the sea and stuff like that.
100%. So we also get educated, the residents, right?
Yes, absolutely.
It's a win-win.
Yes, it's a win-win.
Absolutely, yes. I love that. And Mr. Jan Opperman, right? Would you tell me a little bit about him? Is he part of the organization as well, or
No. Mr. Jan Opperman was a homeless person. Also was quite a romantic story. Jan Opperman has been living on the streets of Sea Point for close to 2 years, approximately 2 years. Now, when the first time I met him was in December of last year.
right?
I saw this man sitting on the beach with a wheelchair parked next to him, and he was on the lawns. And I noticed he was an amputee. Then I asked if I could have a chat with him when they would sit next to him, and he told me a bit about himself. He says, no, he's been living on the streets here in Sea Point for a while, more than 12 months, close to 2 years. But he felt quite tired that day, and I said, okay, I would come back, and then I haven't seen him for a couple of days, and then one day I saw him again. And it was raining that day, and I noticed he didn't have a blanket or no shelter, nothing. So I arranged with one of the shelters, a shelter in Kensington, for a sleeping bag to provide for him. so that at least he's protected from the elements and that. And then I had a good discussion with him. He told me about his history, that he's actually from Ceres. He grew up in Ceres, was born in Ceres, and he was a farm laborer. He worked on one of the fruit farms in Ceres. And then in 1985, he had an accident with one of the farm implements, one of the tractors or something, who cut his leg and ground up his leg and stuff like that.
Right.
So he ended up in hospital and they had to amputate his leg. And then the farmer, when he came out of hospital, had no use for him and said, you can't pay him, and just put him out.
Just like that?
Just like that, off the farm. So he ended up on the street of Ceres.
Right.
Then one morning, he took an opportunity with one of the trucks that come to normally come down to Cape Town to deliver flowers and fruit and stuff. And he ended up on the streets of Cape Town, on the CBD.
Right.
And when I asked him if he still has any family left in Ceres, and he said no. He's got no family, no siblings, no parents, nothing.
Right.
But I gave him the opportunity to possibly go back to Ceres, and he was over the moon. He was excited. He hasn't been back to Ceres for 38 years. He's
Wow,
never
that's
been
amazing.
back once to Ceres.
So the reason I was asking about it, hey, Mr. Kevin, is that I wanted viewers to know that there's a human behind the
There's
facade, right? So
absolutely.
is he now also actively involved with Project
No.
Hope, or is he one of
He's one of
the guys working right now?
He's one of the guys
Yeah.
where I placed him at the night shelter in Ceres.
Oh, wow,
I
that's
gave
amazing.
him that opportunity.
Okay.
I said, and I made contact with this social worker,
Yes.
because he doesn't get a grant, a pension, nothing. So the social worker at the shelter, the Haven Night Shelter in Ceres, said, no, let's work with him. They're going to make application for an ID document for him, and then apply for a grant for him as well.
So basically, get all the paperwork.
Get all the
for him,
paperwork,
the
yes.
legalities in
And
place.
he's back in his hometown.
That's amazing.
Yes.
You see, viewers right there. So there is the impact that we are
Yes.
looking for, and the change, transformative change that we are looking for,
Of
right?
course, absolutely.
So that is so. I felt that we need to share that with the viewers, just to
Yes,
give them an
yes, yes.
overview, like the extent, the impact of,
Yes.
and how important your organization is. And with that, won't you just tell our viewers how they can best support your organization to also bring about, be able to help people across, Western Cape, like Mr. Jan Opperman. How do they get a hold of you, and how then can they actually support your cause?
Yes, definitely. So obviously we always need funding. We need funding to reintegrate these people back into society. We need funding for bus tickets to reunite them with their families, especially out of the province. So I want to appeal to people out there, because this project we want to grow and
Expand, yeah.
expand out of Sea Point, out of Fresno and Bantry Bay, beyond the
Yes.
borders of SFB as well.
Right.
So we're going to want to ask the viewers to go to our Facebook page. It's called Project Hope Cape Town. You can also send us an email. The email address is Project Hope, one word,
Yes.
Project Hope, one word, projecthope.sfb@gmail.com. Okay, or you can go to our Facebook page, as I said, Project Hope Cape Town.
Wonderful.
Thank you.
So, viewers at home, you've heard for yourself. You've gotten the context from Mr. Kevin. Thank you so much for sharing that.
Thank you,
Please,
Thabang.
you do have a role to play, and I love the concept that you at home, sitting right now, watching the program, can actually make a difference. Support the cause so that we can have our members of community who are the most vulnerable and underprivileged integrated back into a community, and then become contributing members of our society. Thank you so much for watching. Thank you so much, Mr. Kevin, for being here.
Thank you, Thabang, and
Wonderful.
thank you to your viewers.
Thank you so
Thanks
much. Thank you.